This is Dr. Robert Watkins, orthopedic spine surgeon to professional athletes and creator of the Back Doctor app. Hi, everybody. Today's podcast is a radio interview I did on May 18th, 2019 on Sports Medicine Weekly. It's a radio show out of Chicago with Steve Cashel and Dr. Nick Verma. It's on back pain and athletes. I hope you enjoy.
That's our next guest, and what a great guest. Dr. Robert Watkins is the Vice Chief of Staff at Cedars-Sinai Marina Del Rey Hospital, co-director of the Marina Spine Center, and how about this, spine surgeon for the Los Angeles Dodgers, Los Angeles Rams, and the L.A. Clippers. You got some good teams out there, Doc. How are you?
I'm doing great, thanks. Appreciate you having me on.
Absolutely, appreciate it. And let's start with this, because it's when Dr. Verma says we've got some advances here, I think people are opening their eyes, say, wow, I don't have to go under the major surgery. But tell me, first of all, what is the most common cause of back pain?
So back pain is an epidemic. Everybody gets it at some point in their lives. And part of the issue is there's multiple reasons for the back pain. It can be the disc, the facet joints, the nerves, the muscles, the ligaments. People hold stress in their backs. So it's so multifactorial that it's difficult to work out what exactly is the source. But that's just what you alluded to earlier. That's exactly the issue. You got to find out what the exact problem is in order to treat it. 80% of the time, the disc is where the biomechanical stress is occurring. So the athletes we take care of, if they throw their back out, get bad back pain, we assume they've torn one of the discs, and we want to shut them down and let it cool off so that it doesn't get worse. If the tear gets bigger, you can get a herniation, which can hit the nerve, go down the leg, and those are things that sometimes we operate on. But generally, it's the disc is the real biomechanical work, and so you want to protect the disc. And if you throw your back out and have a lot of back pain, you've probably hurt the disc, and you want to let it heal so it doesn't get worse.
Dr. Watkins, thanks for being with us. This is Nick Verma. One of the things that we see a lot at the professional level, and frankly for all of our patients coming in the office, is the dreaded MRI scan, right? Because you get an MRI scan, and once you get to be probably, 15, 20 years old, you never get an MRI that says normal back.
Yeah.
You get tons of things written on there. It's enough to scare anyone from going to see somebody like you in the doctor's office. Talk about how you use an MRI scan, and what are your thoughts about when an MRI should be ordered for a patient?
Yeah, typically if somebody's not getting better after 6 to 12 weeks, we'll get an MRI just to define what the problem is, make sure they don't have some tumor. And in athletes, we pick up stress fractures. We get bone scans, actually, to make sure they don't have a stress fracture. It gets missed a lot in athletes, especially in their adolescence. But MRIs, you're exactly right. You'll find abnormal findings on anybody's MRI, and so most doctors won't let them get an MRI on themselves because they don't want to see what it looks like. And so we certainly don't treat the MRIs, but the MRIs it's an amazing test, to be able to see three-dimensionally inside somebody's body, see what the discs look like, see what the nerves look like, see how much pathology there is, what's potentially the source of the pain, what may be amenable to an injection, a cortisone shot to relieve the symptoms to allow the physical therapy to be more effective. But in general, back pain, you're going to treat the back pain non-operatively for 6 to 12 months. You're going to go nonstop. And the main thing is getting the muscle strong. Get your core muscle strong to take the stress off the spine so that no matter what the MRI looks like, build up that muscle strength to take the stress off the spine to decrease the pain coming from the spine.
And, one of the things that we think about, obviously, from a physician standpoint is the difference between back pain and leg pain, which we call radiculopathy. Can you help the listeners understand what the difference is and how it may affect the way we manage them?
Yeah, exactly. And that's the biggest distinction. The biggest thing we ask people is how much back pain do you have versus how much butt and leg pain do you have? And generally, the symptoms that go in the butt and down the leg are the nerve compression. And that's what's amenable to a surgery. And so these microscopic, minimally invasive surgeries we do, that just treats the nerve pain. So if there's pressure on the nerve, we can sneak in through a really small incision, take the pressure off the nerve, quick, easy surgery, outpatient surgery. But all we're doing is taking the pressure off the nerve. We're not fixing the underlying biomechanical issue, which is the degeneration and wear and tear of the disc and the joints. And so the surgery doesn't treat that. So the surgery may not treat the back pain. So generally what we'll do is we'll do the minimally invasive surgeries, take the pressure off the nerve, but then do the core stabilization, muscle strengthening rehab to take the pressure off the rest of the spine to treat the back pain without doing surgery for the back pain.
Great stuff. Dr. Robert Watkins is our guest, Cedars-Sinai Marina Del Rey. He is the spine surgeon for the Dodgers, Rams, and Clippers, of course, all out of Los Angeles. And Doc, where are you seeing more back pain? Baseball, football, or the basketball?
Yeah, football is number one.
Yeah.
The NFL is such a physical sport, and that's number one. Baseball is number two. All the rotation that occurs in baseball, it's a grueling sport. Last 8 months, I don't think people really appreciate what a sport of endurance it is every night. And basketball is probably the least. That's more, the ankles and knees. And golf is certainly pretty high, and hockey's pretty high, too. Those guys really take a beating, too, and they're hardcore athletes. I may mention one other thing. The rehab program we do of this back strengthening that we treat all the athletes with, we actually have an app called Back Doctor, and it's free in the App Store, and our whole rehab program for backs and necks is in this app, and anybody can download it, have it on their phone for free, and it's the same program we treat them with.
That's such great information. For me, when I started in baseball, it was amazing to me how frequently backs are a problem. And it's exactly as you said. It's the rotational problem. And then on the pitching side, it's the hyperextension issue that happens as they go through their pitching motion. I think that as we see these patients, probably the biggest thing that I'm sure you do in the office is help to educate them about where their pain is coming from, why it's happening, and how to help it get better. So we really appreciate things like the app that you created that helps patients to learn about their condition, because I think for them, understanding the condition and the natural history and the things that they can do, weight loss and activity modifications and strengthening programs, those are probably in most cases more effective than a surgical option. Would you agree?
Yeah, that's absolutely true. And sometimes the MRI and the CT and the studies are helpful for that, because then you can show the athlete or the patient what the problem is. You can put your finger on it and say, look, this is not normal. So you're going to have to add 15 to 30 minutes to your usual routine of doing these back exercises, because you're different than everybody else. If you don't have back pain, you're going to have to put in extra work of doing the rehab to take the stress off these structures. And that's hard. A lot of the athletes, they've got their routine, especially baseball players. They do their same routine. They're superstitious. They do it all the time. And you tell them, look, you're going to have to add 15 minutes of back exercise every day. They can be resistant to it. And you've got to show them why. And you got to prove it to them.
And final question for Dr. Robert Watkins, again, a spine surgeon for the Dodgers, Rams, and LA Clippers from Cedars-Sinai Marina Del Rey. Doc, when should surgery be considered for back pain? Listeners want to know.
Yeah, one of the reasons when surgery for back pain does work is if you've got some instability. So sometimes the bones shift in relation to each other, a spondylolisthesis or a scoliosis where it gets crooked. So there's sometimes where biomechanically the spine is falling apart, and we're able to correct it with screws and rods through still minimally invasive techniques and computer navigation, where we fix this mechanical deformity. That can help back pain, and that works pretty well. But if it's basically just isolated back pain, structure, everything looks pretty sound, then you really almost never want to have back surgery, and that's where you want to treat it non-operatively and use our app, use all the rehab, do cardiovascular exercise, and do everything you can to avoid the surgery.
Great stuff. One more from Dr. Nick.
Robert, is there any indication these days for the newer biologics that we're sometimes using in the shoulder and the elbow? You guys using any of that in the back, PRP or stem cells or other interventions?
Yeah, that's a great question. In fact, I'm doing a whole Facebook Live series on interviewing doctors who are doing stem cells to get to the root of where does it really work. And as of right now, there is no regenokine, PRP, stem cell biologic for spine injections today. And in fact, I do injections myself. I do epidurals with cortisone for if somebody has nerve pain in the athletes, because we know it works and it gets rid of the inflammation as reliably and as quickly as possible. And then do the exercises to treat the rehab. All the biologic injections, you don't want to inject the disc, because it just, whatever you inject in there dies pretty quickly, and you're puncturing the disc and violating it to inject it, which can be harmful. So we mainly do epidurals to decrease nerve inflammation, is where the injections are most effective at this point.
Great stuff.
Wonderful. Dr. Robert Watkins, really appreciate you joining us and lending your expertise for our listeners here on Sports Medicine Weekly.
Thanks for having me. It was great.
All righty. Dr. Robert Watkins, Vice Chief of Staff at Cedars-Sinai Marina Del Rey and spine surgeon for the Dodgers, Rams, and L.A. Clippers. When we come back, it's our Ask the Doctor segment. We'll tell you how you can get involved. I'm Steve Cashel with Dr. Nick Verma filling in this week for Dr. Brian Cole. It's Sports Medicine Weekly, only on 670 The Score.